Hi, my name's Mary Brady. I'm going to be doing my medication administration. I'm going to start with my MAR here. Millie Larson is my patient. Her date of birth is 1/1/36. She has no known allergies. Her medications include Practice Hariperidol 2 milligrams IM, Practice Insulin Lisipro 10 units subcutaneous with breakfast, Practi Docusate 100 milligram tab oral. Those are all ordered for now. So as I pull them out of the Pyxis or wherever I'm getting my medication, I'm going to practice Docusate 100 milligrams to my MAR, practice Docusate 100 milligram tab oral. Next is my practice Insulin Lisipro 10 units to practice Insulin Lisipro. This is 100 units per milliliter. Finally, on my MAR is practice Hariperidol 2 milligrams to practice Hariperidol. Here, this is 5 milligrams per milliliter. All right, before I start to prepare my medicine, I'm going to wash my hands here and put on some gloves. Oops, those ripped. All right, first is my Docusate. Docusate 100 milligrams. Docusate 100 milligrams. To my MAR, Docusate 100 milligrams. I'm just going to pop that into a cup here, which I have labeled Practi Docusate 100 milligrams. Next, I'm going to do my insulin. Ordered on the MAR, Practice Insulin Lisipro 10 units. I have Practice Insulin Lispro. I'm going to pull up 10 units of that. I'm going to point you down so you can see what I'm doing. I'm going to take an alcohol pad, pop the top off here, take my insulin or my alcohol pad for my insulin, clean the top. I'm going to take my insulin syringe, open it, pull back to 10 units because 10 units is ordered according to the MAR here. Pull the cap. I'm going to insert the needle into the vial here on the counter, pull back, and so you can see I'm going to bring that up to my eye level, and I'm going to pull back the plunger to 10 units, and I'm going to ensure there's no air in my vial. I'll put that back down, pull it out, and then I'm going to scoop the cap. I have a label here, Practi Insulin Lispro 10 units. According to my MAR, Practi Insulin 10 units, and I'll label that for Millie. Finally, I'm going to do my Haliperidol. Haliperidol is 5 milligrams in 1 milliliter. According to the MAR, I need 2 milligrams. That means I need 0.4 milliliters of Haliperidol. So again, Haliperidol to the MAR, Haliperidol 2 milligrams, so I need 0.4 milliliters. I'm going to pop that off, take an alcohol swab. I'm going to clean the top here. I'm going to take a syringe. Open it so I remain clean here. On the top, pull out my needle. I'm going to pull back to 0.4 milliliters because I need 2 milligrams. Insert that into my vial. Bring it up to eye level. And I'm going to pull back. And I'm going to ensure that I don't have any air here. Pull that out, activate my safety, take the needle off, and that goes right into sharps. Sorry. Hey! Shh! Shh! I'm so sorry, the mail's here. Shh. Shh. Sorry, I'm so sorry. I'm going to take another needle and I'm going to put that right on top of the syringe here. That's 0.4 milliliters for 2 milligrams of Practi-Hariperidol. I'm going to have a label here that says that, so that is all ready for Millie as well. Clean up my mess, take off my gloves, wash my hands, and I'm ready to go see Millie. So I'm going to go see Millie. I'm going to knock on the door. Hi, Millie. My name's Mary. I'm going to be your nurse today, and I have some medicine for you. Can you tell me your name and date of birth? Here's Millie's arm. Millie Larson, according to the MAR, Millie Larson, 1/1/1936 and 1/1/1936. And her MR record I can see is 1, 2, 3, 4, 5, 6, which also matches the MAR. Okay, Millie, do you have any allergies? No known allergies. That's great. So I'll explain the medicine as we go. Let me wash my hands here and put on some gloves. Okay, Millie, we're going to start with your Docusate. Docusate is for constipation. Have you ever taken it before? Great, and no reactions or anything. That's great too. For my last check, I'm going to compare my MAR. Practice Docusate 100 milligrams, and then my Practice Docusate 100 milligrams. I'm going to give this to Millie. Millie, do you have any problems swallowing pills with water? No, so I have water here for you. I'm going to give her this pill. I'm going to watch her swallow it. Make sure it goes down okay. Make sure there's no problems with that. And then I'm going to move on, take my gloves off, wash my hands again. All right, Millie, next we're going to do your insulin. Have you taken insulin before? You have. That's great. So you know insulin is for your blood sugar. Ordered on the MAR here, Practi Insulin Lispro, 10 units sub-Q. That's what I have in the syringe here, Practi Insulin Lispro, 10 units sub-Q. So do you mind if we do it in your belly? No, that's great. When we pick a site, we want to avoid any bruising, any marks, any previous injection sites when possible. So on your belly, if this was your belly button here, you can kind of see it. You want to be at least an inch away. After you pick your site, we'll clean outwards in circles, and I'll allow that to air dry. I'm going to pull the cap here. With the sub-Q injection, I'm going to pinch the skin a little. I'm going to insert this between 45 and 90 degrees, depending on Millie's adipose tissue here in her belly. I'll insert that, press the 10 unit sub-Q in nice and slow, pull out the needle, and activate the safety before putting that in the sharps. I'm going to take a pad here. Just in case there's any bleeding, I'm going to hold this for a couple seconds. All right, Millie's not bleeding, looks great. So we're going to move on to the last thing. Take my gloves, wash my hands again here. Take another pair of gloves. All right, Millie, last is your haliperidol. That's for agitation. Have you ever taken it before? Yes, you have. That's great. It goes in your muscle. Today we're going to use your deltoid muscle here. I'm going to show you myself. It's going to go right here in this muscle. Do you have any questions about that? And you said you had taken it before. Great. And it's for agitation, like I said. On the muscle, again, we're going to clean outwards in concentric circles. I'm going to allow that to air dry. My last check, Practi-Hariperidol 2 milligrams against the MAR, Practi-Hariperidol 2 milligrams IM for agitation. Again, that's 0.4 milliliters you're going to get. I'm going to take the cap off. And with IM injections, I'm going to put this into the muscle at 90 degrees. I'm going to pull the skin a little taut and put that right in. Inject that in nice and slow. Pull out the needle, activate the safety right into the sharps container, and again, I just need a gauze here. I'm going to hold that on there, make sure there's no bleeding. Sometimes with these, you might have to hold them a little longer or put a Band-Aid on. Looks like Millie's not bleeding, which is great. I'm going to take my gloves off. And I'm going to ask Millie, do you have any more questions, Millie, about your medicine? Do you have any concerns before I go? I want to reiterate, we were in a private room, so there was privacy the whole time. I left Millie in a safe and comfortable position. And I think that's it. All I have left to do now for myself is I'm going to document on the MAR. Millie is safe, comfortable again, and that's it. All right. Thank you so much. Before I go, I just want to mention when my medication administration was over, I did wash my hands before I left the room. Thank you so much.